We do not have to rely on guesswork.
She is a mission-driven engineering leader with a passion to solve complex healthcare systems and who has built a technology company that is a winner of our 2026 HealthTech Impact Award.
For the hospital systems, there is like $500,000 to $2 million saving. That's like the very, very conservative engineers' numbers. The numbers are much, much higher. How can we enable this data to talk to the provider? To say, okay, I'm at this stage, these are the options in front of me.
Welcome to Provider's Edge, where healthcare leaders and innovators learn how to scale smarter, lead stronger, and create lasting impact. Your patients don't always know when a small symptom is becoming a serious problem, and your team cannot watch every patient around the clock. So how do we watch the right signals earlier without adding another dashboard or more work? In this episode, Tayaru Bayyana shares how patient data, machine learning, and better communication can help close that gap. Whether you run a practice or building a healthcare solution, this conversation challenges us to make care more proactive without making workflows more complicated.
Yeah, thanks, Sabrina, for having me here. And thank you for this opportunity to talk to you. So, I am the CEO, CTO, and founder of SereniCare AI. It's a digital health platform which will enable patients navigate the chronic illness care journey. Basically, I have my data. I am chronically ill. I'm a stage 4 cancer patient. I have access to my data. The hospital systems have access to the data. How can we enable this data to talk to the provider? To say, okay, I'm at this stage, these are the options in front of me. Like, use the data to enable providers make the best decision and drive the best decision for patients. We do not have to rely on guesswork. So when you are chronically ill, you end up in ER n number of times. So why? I know what is happening with me, but I don't know why is it happening with me. If I bridge the communication gap through a software, which is SereniCare AI, as a patient, I can enter the symptoms. As a provider, can see the dashboard, look at the risk, what's happening with the patient. Just bridge the gap, call them in for an in-person visit. That's like the simplest solution we could have, and that's what is SereniCare AI is here for. It's a whole digital health platform serving providers, patients, and payers to make the care more patient centric and human centric overall.
Yeah, it's definitely about better communication, especially people like yourself who is going through a lot. And when we have multiple chronic disease or acute illnesses, then it's like things just add on top of each other. And sometimes you don't even know how you feel. I have patients who come into the ER thinking, oh, it's just my sugar a little high. And then they end up needing to be on my surgical table for heart
Yeah.
bypass, and they didn't even thought about that way. It's like, oh, it just always happened. Maybe I just need my insulin didn't get delayed, right? So sometimes because things are so complex, we don't exactly always feel sick. Or when we have symptoms, oh, we were thinking about all this possibilities, just like what a clinician would do, right? Well, is this
Hmm.
symptom? Did you have associated things? Did you have something else happening before or after? That help us composite that. But on the everyday people, without those training, it's hard to tell. So you guys are about how do we communicate from a day-to-day base back to my provider, whether it's my oncologist, my primary care, my cardiologist, who's
Cardiologist. Yeah.
responsible for subset of disease. So there's a closed loop communication. And then the appropriate people, whether that's nurses and APPs, physicians, can all then get to the right decision faster without you feeling like, oh, no, my leg is just getting heavier, right? Yeah, maybe I'll just
Yeah.
take a water pill. but that something else really is happening on the back end. You maybe is in a heart failure now. It's not just a leg being more puffy. With you guys are how you build, what stage of company are you in now?
Yeah, so we have the MVP built. So I'll just give you a background of why SereniCare AI. I went through the journey of supporting my dad through his stage 4 cancer. As a problem solver, it hit me really hard being not able to solve the problem. I would say it's mostly emotional and physical. Every burden hit me really hard, and I really don't want this experience given to so many caregivers currently. Yeah, the aging population is doubling in US in next 5 years. That means most of us will go through this journey of caregiving, and the complexity of navigating everything along with the emotional stress is too much, and we have so much on our plate along with the caregiving journey. So that's how SereniCare AI is born. Coming back to the question of, okay, yeah, we want to serve all the personas really well using the patient data to come to the right clinical decision conclusion. At this point, we'll gather the data from different discrete sources, aggregate the data, we train the machine learning model, create a clinical decision support system for providers, helping patients navigate this journey really well, Sabrina. The stage at which we are in, we have built the provider facing piece of the application, and we have built the patient facing face of the application. We have the minimum viable product built, and we want to launch a pilot with a small to medium hospital system to see how we improve provider outcomes as well as patient outcomes.
Yeah, for sure. It's now you're in this phase of we build it, we are tested. Let's get into a hospital to really see how it works. And I think the biggest question for most of us who are clinicians is like we love all these amazing ideas. Now it's that making our patient care experience easier, or it does it seem like it's adding more work for us? And
Mhm.
who is responsible when these data points coming in to better respond in the timely fashion, right? So have you guys thought about, are you already working on integrating with the existing EHR system, or this is the next phase to go?
Yeah, we are working on integrating with Epic and Cerner. We have the plugins built in. We need the real EHR plugging in opportunity. So we will not be noisy. We will not be a point solution. We will be coexisting with Epic and Cerner, focused on chronic illness care journey and transitions.
Amazing. Now, can you paint us a picture how this entire workflow would look like in terms of how would the patient be experiencing it versus how would the providers be experiencing this?
Okay, let me start from my ICP, who is the patient. If I am the patient, I will get a version of the portal wherein I log in every day. I can add my symptoms as they change day in, day out. So we are giving access to patient, caregiver, family member. They'll get the same view on behalf of patient. You can enter the symptoms. That's one piece of the application. The provider, on the other hand, they will get an aggregated view of what's happening with the patient, more like a, you can call it like a dashboard, and the patients will have risk ranking, and we are using color coding to make it easy for providers. If they are very high risk, that means they'll be marked as red, and provider can click on a specific patient, view details, and see exact symptom what the patient has entered. And because we are coexisting with Epic or Cerner, they can go into the EHR, EMR data to correlate the longer trajectory of what's happening with patient in the short term and long term, come to the right clinical conclusion on what would be the next best step, Sabrina.
Yeah, and then seems like you guys are very focused on patients submitting the symptom data as well as the caregiver, because a lot of time our family members or whoever is providing the care on a day-to-day basis can see a different light than even the patient themselves can see and notice. Are you also integrating with, we know there's a lot of remote monitoring system out there. Are you guys also coexisting in that sense as well? Here's the challenge Tayaru was trying to solve. Patients and caregivers often see changes happening day to day, but providers might not see those signals until the situation becomes urgent. SereniCare AI is designed to close that communication gap, bringing symptoms, patient data, and risk signals together without creating another disconnected system. The goal is to help care teams recognize what matters earlier, make better decisions faster, and potentially prevent avoidable ER visits. Before we jump into the second half of today's conversation, let's take a quick pause and share something that many of you might be perfect in taking advantage. If you are a clinician, industry expert, or established founder running a Series A or above company, then we would love for you to share your expertise in the longevity, women's health, mental health, and overall health innovation space. Apply to be a featured speaker on theprovidersedge.com and share the insight other leaders need to hear. Go to theprovidersedge.com to apply.
Yeah, we will be. So we are in conversations with remote monitoring systems, multiple of them. We want to gather the data, patient data from remote monitoring system as well, and integrate that into the machine learning model we will be training.
That's amazing, because then we know from a data perspective, that's what the vital can tell us, right? And the vitals nowadays is also pain score, right? And not just your pulse, your EKG pattern, which is a lot of them are able to go home with that.
Mhm.
And then some of the we seeing really neat, it's even your vascular age, right? How well are you from even a longevity and health standpoint, and besides the pressures, and then even for us for healthcare heart failure perspective, we wanted to know people's daily weight, right? So now it become a lot more comprehensive. It's not just the numbers data that we can collect from the remote monitors, but also symptomatically, do you have symptoms, do you not have symptoms, because those different symptoms also triggers on how urgent the next step should be taking
Yes.
to take care of these patients, whether that's okay, you can stay home, just do ABC, versus, well, yes, you should come to the ER. We do need to see you more urgently, or actually, we can fit you in tomorrow. It's not
Mm.
to say you have to go to ER now, right? So it's
Yeah.
being able to be more comprehensive in the way that we're treating and reduce amount of stress
Yes.
when we have patient themselves and the family themselves that have no idea what's happening. They'll be calling the office for hours, nobody's picking up because the lines is very busy, and that causes stress. And then the providers is also very much, we're always about protecting our license as well. Do good for the patient, but we also have
Mm.
a responsibility of knowing the right information and only be able to provide the right services based on that information. So, have you guys have a few different conversation with the letter in 10, or that's the current focus right now?
That's the current focus right now, Sabrina. So we are having, like, we have some conversations in flight. We want to close them pretty soon, is where we are.
Yeah, that's the exciting part. I always believe that we needed to have many pilot contracts side, and then simultaneously also raise your next fund so you can keep running, right? Because your pilot gonna require some funding to have the right staff, the right integration, right? To get
Yes.
things moving, because the early stage pilots, you're not getting paid for from these hospital. It's really about testing. And when that
Hmm.
one pilot is successful, that give you the opportunity to go to other departments and other sectors. So that's a very exciting exciting place. Do you guys have some time a time frame on your goal is what's your next goal, right? Is that the next 3 months you're hoping to have your first pilot secured? I would love to hear from that.
Yeah, you spoke my words. Yes. By June, I want to have like a pilot secured and launched, preferably by June. That's a little aggressive, but that's exactly the goal, strategic goal for the company.
Amazing. And then are you guys also actively fundraising?
Yes, we are actively fundraising at this moment so that we are ready to go to market. And as you said, instead of walking, run with right resources at right places. Yes, we are having the fundraising, active fundraising round right now.
Perfect. And then how much are you raising right now?
So we are looking anywhere between 500,000 to $1 million. We are open to angels who are passionate about the overall chronic illness care, who have personal belonging here. So if they are passionate angel, the check sizes are like $50,000. But if it's like VCs, it's 500,000 to $1 million. That way we have a longer runway.
Perfect. And then so then help us, my goal of working with you guys and then just like you jump into our pitch workshop before you even pitch on stage is all about how do you present the edge that you have in front of investors, right? So when you think
Mhm.
about chronic disease has multiple different modalities, yeah, remote monitoring, symptom management like you guys, and then better medication compliance, which is another niche and then or early diagnostic for those people who can go from a renal disease that links to cardiac, linked to diabetes, linked to all those things. What is that edge that you guys are putting together that really put you out more of another step level than your competitors that you say, hey, this is why other people should be investing in your company?
Yeah, so the edge we are providing is the end-to-end infrastructure, which can be used across oncology. So, like our first pilot would be oncology focused, but the same application can be used for cardiology, neurology as well. So the moat we have is the core machine learning algorithm looking at all aspects of patient data, enabling providers to make the right decision. And we are building infrastructure around it, which would save, like the workflow automations we are providing, will save time for providers. Overall stress, overall guesswork is eliminated from providers day to day. For the patients, it's a package which will bridge the communication gap as well as enable them to speak their own words to the provider in an indirect manner, and it will improve patient outcomes. It will enable them to make better decisions using their own data. That's the patient piece. For the hospital systems, it's like, yeah, there is like $500,000 to $2 million saving. That's like very, very conservative engineers' numbers. The numbers are much, much higher. Those are the cost savings for hospital systems. Overall, it's a win win situation for provider, patient, payer, resulting in better care for the patient. That's like the moat. We are like, I would say this is not another point solution just focused on one area. It's the overall infrastructure, which can be extended to other chronic illness areas. Yeah.
Great. So what I'm hearing is we're starting with oncology where it's a very complex system. What the true edge is the machine learning is pulling multiple information about the patient. It's not even just the symptom side. It's about their data, what appointment they had before, how was their experience the last time when they're in the hospital, being hospitalized. So we can prevent them from getting back into being hospitalized again, and that's the hospital
Yes.
side of cost saving and also patient side of cost saving as well as the payer side of cost saving. And from a clinician side, it's a less headache of going through all the charts of what's have happened
Yes.
for all the past visits, outpatient appointment, inpatient appointment, and then you can see a chronologically predictable trend of this patient and engaging with them where they need it, and not wait for the patient raising their hands, because by that time sometimes it is really too late, because the
Mm-hmm.
patient family caregivers do not always have the right knowledge on what is
That's
the
true.
true urgency to act. Now we're getting into what makes healthcare innovation actually usable. It's not enough to collect more patient data. That information has to fit into the system clinicians already use. Help them spot who needs attention first and lead to the right action. For Tayaru, that means integrating with existing EHRs, remote monitoring, and patient-reported symptoms while building toward an oncology pilot that can prove better outcome, save provider time, and reduce outcome. So for all of you visionaries out there who have an idea, a startup, an innovation that could really change how we take care of patients in the health dental wellness space, bring your idea to Hot or Not. You'll get just 2 minutes to pitch your company in front of investors, clinicians, and operators in your ecosystem. Then the audience weighs in. Is it hot? A solution the market really do want, or not? A concept that needs more validation. Also known as pitch to yes, this is your opportunity to pressure test your message and get real feedback, and potentially connect with partners, customers, and investors. Submit your pitch at pitchtoyes.com and join us for this virtual event. Because great idea deserves honest feedback, not just a pat on the back. So we appreciate you for being here. Anybody who would be an angel or venture investor, please contact Tarun. We will have all the links in the show note below. And then for anybody else who could be a health system pilot side that really wanted to have a conversation in, hey, we want to test that out in my cancer center, in my patient side, please also reach out to set up that next project. So we so grateful for everybody who's continue to be innovative, continue to think outside the box. Building powerful technology is one thing. Getting it into a hospital's existing workflow, fit into what clinicians really want to use and what patients will actually comply to, and proving it can improve outcome without adding work, that's where real test begins. Tayaru's journey shows why HealthTech founders have to connect patients' needs first. Then think about the clinical decisions and measurable business value from day one. So if you're building the next healthcare solution, here are 5 lessons to take with you. Number 1, patient data only creates value when it leads to action. Patients and caregivers notice day-to-day changes that providers might not see. Connecting those symptoms with clinical data can help care teams identify risks earlier and decide what should happen next. Number 2, preventing avoidable ER visits starts before the emergency. Better visibility into symptoms, vitals, and patient history could help clinicians distinguish between someone who can safely stay home, someone who needs an appointment tomorrow, and someone who needs urgent care today. Number 3, health technology has to fit clinicians' workflow. Another dashboard or disconnected tools can create more work. We emphasized integrating SereniCare AI with Epic and Cerner rather than operating as another isolated point solution, which many companies have not yet able to do. That's why investors hesitate, because it's adding more work. Number 4, a successful pilot needs to prove more than the technology works. For an early stage technology company, the pilot is an opportunity to demonstrate better patient outcome, improve provider workflow, and measurable cost saving. before expanding into additional departments or health systems. At the end of the day, no one cares how you do things. They only care about how you're making their life easier, making costs lower, or making overall satisfaction better. Number 5, scalability comes from solving a repeatable problem. Tayaru plans to begin with oncology, but the underlying infrastructure is intended to expand into areas such as cardiology and neurology. That creates a path from solving one complex use case to addressing chronic care more broadly. If this conversation got you thinking how connected patient data into an actionable clinical decision and help prevent ER visits, then I have another episode for you. Check out what Samsung bought excels and what founders should learn with Mike Mashuri, where we explore how excels create enterprise value by connecting digital tools, devices, and patient care directly into clinical workflow. You'll find the link in the show note below.
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit sabrinarunbeck.com/connect and send me a direct message. Talk soon.